As always, welcome back to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. Today, we will be discussing numerous important key developments these past 7 days in the Middle East region across healthcare, life sciences, and wellness. Areas that are not only important to the Middle East population, but to the respective ministries, organizations, hospitals, healthcare providers, pharmaceuticals, biotech, and wellness groups. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to June 12, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data gathering platform HealthConnect Middle East. Let's first discuss healthcare policy and government initiatives. Governments launched major health policy measures and initiatives during the week. In the Gulf, protecting workers and pilgrims from summer hazards was a top priority. United Arab Emirates, UAE, and Saudi Arabia both reaffirmed annual bans on midday outdoor labor to prevent heat stress. The UAE's Ministry of Human Resources announced its 21st consecutive midday break rule from June 15 to September 15, prohibiting work under direct sun from 12:30 to 3 p.m. Saudi Arabia's government likewise decreed a nationwide noon to 3 p.m. work stoppage for June 15 to September 15, emphasizing it as an occupational safety measure to curb heat-related illnesses. Officials in Riyadh stressed that employers must adjust schedules and that the move, in cooperation with the National Council for Occupational Safety, aims to provide a safe work environment in line with international standards. Other Gulf states mirrored these steps. Qatar's Labor Ministry had already begun enforcing summer hours from June 1, no outdoor work after 10 a.m., as part of a heat stress awareness campaign, and Oman's Ministry of Labor launched a Safe Summer campaign alongside its own June-August midday work ban. These coordinated policies underscore a regional push to safeguard worker health during extreme weather. Bahrain focused on strategic health governance and financing. This week, Bahraini leadership reviewed progress on priority health projects under the government's unified framework, with a royal visit to the health ministry highlighting the importance of citizen-centered program implementation. Bahrain is in the midst of an ambitious health sector overhaul. As part of its 2025 to 2026 budget, it is rolling out mandatory health insurance for all expatriates and visitors, aiming to relieve pressure on public hospitals and ensure sustainable funding. Under this plan, about 686,000 expats and 1.6 million annual visitors must obtain coverage, with new visa fees for tourists and private insurance for foreign workers. The reform also channels investment into expanding facilities, including new health centers and a national genome research center, and into a national organ transplant program, signaling a comprehensive approach to strengthening Bahrain's health system. By week's end, officials in Manama affirmed that these initiatives, supported at the highest levels, are on track to enhance service quality and meet citizens' needs. In Jordan, health diplomacy and humanitarian policy took center stage. King Abdullah II's Jordan Medical Corridor initiative, launched in March, saw tangible progress this week as Amman evacuated a new group of 16 sick children from Gaza for treatment in Jordanian hospitals. The latest evacuation on June 11 included cancer patients and their families, some airlifted and others transported by land, in coordination with the WHO. This brings the total evacuated under the program to 57 Palestinian children, with over 100 relatives, since its inception. One child in this cohort was further sent to Saudi Arabia and another to the UAE for care, reflecting a collaborative regional effort. The Jordan Medical Corridor, launched upon royal directives, aims to ultimately treat 2,000 Gazan children and stands as a hallmark of Jordan's humanitarian outreach. Domestically, Jordan is also contending with sustaining health services for Syrian refugees. A health sector working group report warned on June 3 that funding cuts threaten to collapse refugee health programs, an issue the government is raising with international donors to prevent a public health crisis among displaced populations. Several countries used the week to bolster public health planning and intersectoral cooperation. Kuwait reaffirmed its commitment to vulnerable groups and international health goals. Officials highlighted the recent launch of the Kuwait Disability Guide 2025, developed with WHO, to improve services for persons with disabilities, and in May the Health Ministry rolled out a National AIDS Strategy, 2025 to 2029, to strengthen HIV prevention and care. These initiatives, while earlier in the year, frame Kuwait's current policy emphasis on inclusive, preventive care. Regionally, Kuwait is also spearheading a One Health approach. The Kuwait Institute for Scientific Research announced readiness to host a GCC-wide meeting on zoonotic disease control, scheduled for mid-June, underscoring cross-border policy coordination on health security. In Iran, health officials continued to emphasize self-reliance and traditional medicine within policy debates. Though no major new policies were reported this week, Iran has been vocal about achieving pharmaceutical self-sufficiency, recently claiming that domestic manufacturers can meet vaccine needs despite sanctions, and integrating traditional remedies into medical curricula as part of its health policy vision, a move that has sparked debate within the medical community. Across the region, these government-led initiatives reflect a dual focus, addressing immediate seasonal and humanitarian health needs while also driving long-term reforms in healthcare financing, access, and cross-sector collaboration. On to our next area to discuss, life sciences and research innovation. The Middle East's life sciences sector saw robust activity, with research-driven initiatives and knowledge exchange geared toward regional health challenges. In Kuwait, preparations were underway for a high-profile scientific gathering aimed at strengthening One Health capacities. Kuwait's premier research body, KISR, announced it will host a regional meeting on combating animal and zoonotic diseases from June 16 to 19, in partnership with international agencies including the IAEA and WOAH. The meeting, bringing together experts from all GCC countries, is set to showcase cutting-edge surveillance and diagnostic technologies for diseases that jump between animals and humans. Organizers highlighted that sessions will cover nuclear-derived diagnostic tools and whole genome sequencing techniques for faster pathogen detection. With climate change and dense livestock populations raising the risk of outbreaks, Kuwaiti scientists stressed the timing is critical to coordinate research and unified policies across the Gulf. High-priority topics include foot and mouth disease, Rift Valley fever, MERS coronavirus, and other transboundary threats, tackled through a One Health lens that links veterinary science, human medicine, and environmental health. Kuwait's initiative exemplifies how regional researchers are pooling expertise to innovate in disease monitoring and prevention. In Qatar, major strides in research and advanced therapeutics are converging in clinical practice. This week, Sidra Medicine, Qatar's flagship women's and children's specialty center, opened a state-of-the-art pediatric hematopoietic stem cell transplant (HSCT) ward, the first of its kind in the country. While primarily a clinical milestone, detailed under hospitals, the new unit also significantly bolsters Qatar's research in genomics and regenerative medicine. During the inauguration, Sidra's leadership noted that the HSCT program is a core part of its precision medicine strategy, enabling pediatric genomic research into rare disorders and cell therapies. By treating children with complex blood cancers and genetic diseases locally, Sidra's specialists can simultaneously study the genetic underpinnings of these illnesses in Qatar's population. The ward's integrated GMP laboratory and its plans for both autologous and allogeneic transplants will not only save lives but also generate data and innovative protocols for the region. This blending of cutting-edge care and research positions Qatar as an emerging hub for life sciences in the Middle East, fostering discoveries in pediatric oncology, immunology, and rare genetic disease. Elsewhere, countries continue to invest in research and innovation frameworks. Saudi Arabia's participation in the Global BIO 2025 convention, to be held in Boston later in June, underscores its commitment to R&D-driven growth. In the lead-up, Saudi health leaders touted the kingdom's integrated biotech ecosystem, from regulatory science to research institutions, as a product of its cross-sector health transformation strategy. The delegation to BIO plans to highlight how initiatives like the Saudi National Institute of Health and major research universities are fueling scientific collaboration. At home, Saudi Arabia has been building research centers of excellence, for example, King Faisal Specialist Hospital's Research Center and KAUST, and linking them with industrial innovation zones. This week, Health Minister Fayed Al-Jalajel reiterated that under Vision 2030, Saudi is fostering collaborative platforms where government, industry, and academia jointly accelerate breakthroughs. The kingdom's approach, illustrated by year-long programs and startup accelerators that culminate in events like BIO, is to embed innovation into healthcare delivery itself. For instance, the vast Seha virtual hospital network, discussed below, serves not only patients but also as a sandbox for telemedicine research and AI integration in healthcare. Such efforts signal how Saudi Arabia and its neighbors are increasingly marrying policy with science, backing research that can directly translate into improved treatments, public health interventions, and biotech ventures across the region. Biotech and pharmaceutical developments had very key developments this past week. The pharmaceutical and biotechnology sector in the region saw significant developments as countries pursued self-sufficiency and global partnerships. Egypt made headlines with a major joint venture aimed at elevating its drug manufacturing capabilities to international standards. In late May, just ahead of this week, Egypt's state-owned pharma conglomerate, Holdi Pharma, signed a strategic alliance with US-based Dora Pharmaceuticals to create a new manufacturing and export hub. The venture, which gives the American firm a 60% stake and the Egyptian side 40%, will produce a broad range of products, from sterile injectables and ophthalmic solutions to oral medications and nutraceuticals, targeting global markets. Notably, in its first phase the partnership plans to export 6 types of Egyptian-made dietary supplements to the United States, marking the first time an Egyptian pharma entity meets the stringent US FDA requirements for such exports. This achievement was touted by officials as a milestone for Egypt's pharmaceutical industry, aligning with President El-Sisi's push to localize vital industries and open new export channels. The venture will leverage advanced manufacturing technologies, including pre-filled syringes and transdermal patches, and commit to strict FDA and EMA compliance to ensure Egyptian medicines are globally competitive. This week, Egyptian Prime Minister Mustafa Madbouly, who witnessed the signing, emphasized that the pharma sector is vital for trade and investment growth, and that the government is keen to make Egypt a regional medicine production hub. Egypt's moves complement earlier investments such as the $120 million pharmaceutical industrial zone in the Suez Canal Economic Zone announced in January, which will manufacture active ingredients locally. Taken together, these efforts aim to reduce Egypt's reliance on imported medicines, cut the $3 billion annual import bill, and position the country as a net exporter of pharmaceuticals in the Middle East and Africa. Saudi Arabia, for its part, is aggressively expanding its biotech footprint on the world stage. At the upcoming BIO International Convention in the US, Saudi Arabia is debuting its first national biotech pavilion, which officials previewed with an ambitious agenda. During this week, the Health Ministry highlighted that the kingdom's pavilion will assemble its entire health and life sciences ecosystem, regulators, research centers, investment authorities, and startups to pitch Saudi Arabia as one of the world's most exciting ecosystems for biotech. This presentation will showcase the outcomes of the National Biotechnology Strategy, which seeks to integrate research, fast-track regulatory processes, and localize biomanufacturing in line with Vision 2030. The pavilion's program includes spotlight sessions and a high-level panel featuring key sector leaders, underlining Saudi Arabia's readiness to partner globally on cutting-edge therapies and vaccine development. Notably, Saudi Arabia has been streamlining clinical trial approvals and has designated its Food and Drug Authority as an ML4 regulatory authority, signaling alignment with global best practices. It has also invested in digital health platforms, like NFIS, for e-health records, and boasts the world's largest virtual hospital, all of which will be promoted as enabling infrastructure for biotech innovation. The kingdom's presence at BIO 2025, including a super session with international experts, is intended to cement its image as a growing biotech hub open to investment and collaboration. United Arab Emirates, UAE, sustained its momentum in life sciences, having established a large Dubai Science Park and Abu Dhabi's vaccine manufacturing facility, Hayat Biotech, in previous years. The UAE is attracting partnerships. For example, earlier in 2025, Abu Dhabi announced a medtech and biotech initiative with international collaborators to fuel R&D. Meanwhile, Jordan and Morocco, though the latter outside our region of focus, have been licensing production of insulin and cancer drugs through joint ventures, part of a regional trend of localizing essential medicines. This week's developments demonstrate a clear trajectory. Middle Eastern nations are not just consuming medical innovations but increasingly making and exporting them. Through joint ventures, new industrial zones, and global showcases, the region is carving a place in the pharmaceutical and biotech value chain, one that could make it more self-reliant in health and also a contributor to global health security. As always, let's now talk about public health challenges and disease outbreaks. Multiple countries confronted pressing public health challenges and outbreaks, many exacerbated by conflict or climate. In the Palestinian Gaza Strip, the humanitarian health crisis remains dire in the wake of prolonged warfare. On June 10, UNICEF warned that the collapse of Gaza's healthcare system is posing a grave threat to children's lives. The sheer scale of child casualties was highlighted. Since October 2023, an average of 27 Palestinian children have been killed daily, with total child injury and death tolls climbing relentlessly. UNICEF spokesperson in Palestine, Qasim Abu Khalaf, noted tens of thousands of children are suffering severe acute malnutrition amid what he termed a famine-like situation. Over 40,000 children have been orphaned during the conflict, a number expected to rise further. Gaza's hospitals, many damaged or short on supplies, are overwhelmed, and even basics like clean water and electricity are scarce. Health experts stress that Gaza's children will need years of rehabilitation from not only physical injuries but deep psychological trauma. This grim update underscores that Gaza's public health emergency is ongoing, with immediate calls for humanitarian access, protection of medical infrastructure, and long-term mental health support for an entire generation of war-affected youth. A notable infectious disease outbreak emerged in Iraq. The Iraqi Health Ministry confirmed a spike in Crimean Congo hemorrhagic fever, CCHF, cases, a deadly tick-borne viral disease. By June 12, Iraq has recorded 123 CCHF cases nationwide in 2025, with 19 deaths up from 107 cases and 16 deaths a week earlier. The southern province of Daikar is the worst affected, 36 cases, while the capital Baghdad has seen fewer cases, 18, but a higher death toll, 5 fatalities. Authorities urged urgent measures to contain the outbreak. The health ministry spokesman implored security agencies to crack down on illegal livestock grazing and slaughtering, which are known to spread the hemorrhagic fever via ticks on farm animals. CCHF, which causes high fever, bleeding, and shock, carries a frightening 10 to 40% fatality rate and has become Iraq's most entrenched viral hemorrhagic fever since the late 1970s. Last year's outbreak was especially severe, with over 580 cases and 83 deaths reported in 2023. The uptick this year suggests the virus is continuing to circulate in animal populations. In response, Iraqi public health teams are stepping up tick control, public awareness for farmers, encouraging use of acaricides and protective clothing, and faster case detection and isolation in hospitals. The trend is being monitored closely by the WHO, given the risk of wider regional spread if animal trade is not regulated. Other countries grappled with epidemic risks linked to weak infrastructure and immunization gaps. Syria remains on alert for cholera, following an outbreak late last year. Although no large new outbreak was reported in early June, health officials warned that Syria's damaged water systems and poor sanitation could allow cholera to resurge with the summer heat. The Ministry of Health's recent cholera preparedness workshop, mentioned above under research, identified specific high-risk governorates and emphasized measures like chlorinating drinking water and pre-positioning oral cholera vaccines. The challenges are stark. Syria logged over 1,440 suspected cholera cases between August and December 2024, and many hospitals lack sufficient fluids and antibiotics after years of conflict. Similarly, Lebanon faces a convergence of public health crises due to its economic collapse and the aftermath of regional conflict. Health experts in Beirut have reported surges in preventable infectious diseases, notably measles, hepatitis A, and cholera, as vaccination rates plummet and clean water access declines. A detailed risk analysis published recently indicated high probabilities of outbreaks of these diseases in 2025, given that routine immunizations have dropped sharply. Measles vaccine coverage fell to 53% for the second dose, and millions of people lack proper sanitation. Indeed, Lebanon saw cholera reappear in 2022 after almost 30 years. By early 2024, sporadic cases were still being recorded. With 1 in 4 Lebanese now food insecure and malnutrition rising, the population's vulnerability to disease is growing. Aid agencies are urging urgent reinforcement of Lebanon's public health system, warning that without action, the question is not whether Lebanon will face health crises but how devastating they will be. The United Arab Emirates and Oman, aside from heat-related concerns, reported no major outbreaks, but maintained vigilance through ongoing COVID-19 monitoring and seasonal flu vaccination drives. Overall, the weak snapshot of public health challenges paints a picture of a region where conflict and infrastructure breakdown continue to breed health emergencies, yet countries are striving, with international support, to respond through targeted campaigns and stronger early warning systems. Digital health innovation, always a fascinating area to talk about, is next. Digital health innovation continued to gain momentum across the Middle East, as countries leveraged technology to expand access and enhance healthcare efficiency. Saudi Arabia stood out with its cutting-edge virtual care infrastructure. Officials this week highlighted the success of the kingdom's Seha Virtual Hospital, SVH, which has grown into the world's largest virtual hospital network. Launched under Vision 2030, SVH connects over 130 hospitals across Saudi Arabia via telemedicine, allowing patients even in remote areas to receive specialist consultations and diagnoses from top medical centers in real time. The platform, bolstered by AI-driven diagnostics and a Guinness World Record for its scale, has been a game-changer in Saudi healthcare. In a statement around May 31, the Health Ministry announced new digital services deployed through SVH to serve pilgrims during Hajj 2025, an integrated telehealth suite that enabled remote specialist support for on-site medical teams in Mecca. This innovation ensured that pilgrims had 24/7 access to consultants for complex cases via teleradiology, tele-ICU, and telestroke services, exemplifying how digital health can overcome geographical barriers during mass events. Saudi health officials describe SVH not just as a telemedicine platform, but as an innovation hub for trialing new digital healthcare solutions, from AI triage to wearable patient monitoring. Plans are underway to further integrate SVH with the National EHR system, NAFIS, and to introduce home telepharmacy and rehabilitation services, extending the continuum of virtual care. The United Arab Emirates, UAE, also continued its ambitious digital health transformation. The Ministry of Health and Prevention, MOHAP, is executing a 2025 Zero Bureaucracy initiative that heavily relies on digitization to streamline services. In an update earlier this spring, MOHAP officials unveiled a national unified healthcare digital licensing platform, designed to centralize all licensing for health professionals and facilities across the UAE. This platform, coming online this year, replaces paper-based and Emirate-specific processes with one smart system, dramatically cutting down approval times for doctors and clinics from weeks to mere days. By simplifying credentialing and attracting top medical talent through an easier onboarding process, the UAE aims to boost the healthcare workforce and improve patient access to qualified providers. Additionally, MOHAP's strategy includes establishing a national digital experience center, essentially a digital health laboratory, to incubate new e-health services in cooperation with the private tech sector. During Arab Health 2025, UAE leaders showcased these digital initiatives, emphasizing how telemedicine, AI, and big data are being harnessed to create smart, sustainable, and user-centric healthcare experiences. Indeed, since the pandemic, UAE hospitals have widely adopted teleconsultations. The DHA's Doctor for Every Citizen telehealth program, for example, continues to offer free virtual primary care consultations to residents, a service that saw heavy use in the past week amid the Eid holidays when many clinics were closed. Other countries are investing in digital health in more targeted ways. Kuwait's Ministry of Health, for instance, is expanding its e-health record system and this week reiterated its commitment to regional e-health integration, following Kuwait's participation in the World Health Assembly where Gulf states discussed interoperable health systems. Bahrain has one of the region's most advanced national e-health portals, the Sehati app, and recent efforts include using it to promote wellness, for example, sending push notifications about heat advisories and enabling online appointment booking for summer health checkups. Qatar is actively supporting digital health startups through its Qatar Science and Technology Park. One such startup, MedTech, announced progress this week on an AI-driven symptom checker in Arabic that it plans to pilot with Hamad Medical Corporation clinics. Oman's Ministry of Health in cooperation with WHO, conducted training on a new electronic disease early warning system, helping health workers learn to input and analyze case data via mobile applications, a timely upgrade as Oman monitors for dengue and other outbreaks. Meanwhile, even conflict-affected health sectors are seeking digital solutions. Iraq's government, with World Bank support, is rebuilding a health information system that will digitize patient registries in liberated areas, and just last week signed a contract for solar-powered internet units in rural clinics to bring them online. In summary, the week underscored that digital health is no longer a side project in the Middle East, it is becoming central to healthcare planning. From the Saudi virtual hospital that brings specialist care to every corner of the country, to the UAE's one-stop e-service portals making healthcare more user-friendly, digital innovation is driving improvements in access, quality, and efficiency. The continued challenge will be ensuring cybersecurity and patient privacy keep pace, and that all populations, including those in poorer or rural areas, benefit equally from the digital health revolution. Hospitals had a very significant number of developments to talk about. Healthcare facilities and hospitals across the Middle East marked significant developments, with new expansions and enhanced services improving patient care delivery. In Qatar, a milestone was reached in specialized pediatric care. Sidra Medicine in Doha officially inaugurated its new pediatric hematopoietic stem cell transplant (HSCT) ward on June 3. This advanced unit, the first pediatric bone marrow transplant facility in Qatar, represents a major leap in the country's tertiary care capacity. Her Highness Sheikha Moza bint Nasser, chairperson of Qatar Foundation, toured the ward during the opening, highlighting its role in expanding access to life-saving care for children in Qatar and the region. The HSCT ward has an initial capacity of 20 beds and is equipped with state-of-the-art isolation rooms meeting international infection control standards. It will treat children with cancers like leukemia and lymphoma, as well as genetic blood disorders, thalassemia, sickle cell, and immune diseases, performing both autologous, self-donor, and allogeneic, donor, stem cell transplants. For transplant procedures have already been successfully completed in pilot phases, and the unit is scheduled to begin full operations, starting with autologous transplants, by late June. Sidra's CEO noted this is the first facility of its kind in the country, and it will reduce the need for Qatari patients to seek bone marrow transplants abroad, a significant benefit for families. The ward's opening was also attended by Qatar's Minister of Public Health, underscoring government support for expanding domestic specialized care. By positioning Sidra as a regional center of excellence for pediatric stem cell therapy and research, Qatar is strengthening its hospital infrastructure to meet complex medical needs at home. In Saudi Arabia, hospital systems were mobilized at an unprecedented scale to serve the Hajj pilgrimage, which concluded during this week. The Ministry of Health implemented a massive seasonal plan, operating dozens of field hospitals, mobile clinics, and medics on the ground in the holy sites of Mecca and Medina. According to official statistics released June 11, Saudi Arabia deployed over 420,000 personnel from the public and private sectors, including medical staff, emergency responders, and volunteers, to support Hajj 2025. This workforce served the 1.67 million pilgrims who performed Hajj this year, providing services ranging from urgent care and surgeries to health education. Notably, the Saudi Red Crescent and MOH field teams introduced a new initiative of walking field teams, roving medical crews on foot who delivered first aid and health assistance directly among the pilgrim crowds. More than 1.23 million pilgrims benefited from these walking medical teams during Hajj, according to Saudi health officials in post-Hajj reports. The kingdom's ability to treat heat exhaustion, manage chronic conditions, and even perform complex procedures, like cardiac catheterizations and endoscopies, on-site during Hajj was enhanced by the integration of the Seha virtual hospital network, which allowed specialists in Riyadh to guide care in Makkah hospitals remotely. By the end of the pilgrimage, Saudi hospitals in the Hajj areas had handled hundreds of thousands of outpatient visits and thousands of admissions, yet were credited with zero outbreaks of communicable disease, a testament to planning and hospital readiness. The successful Hajj health operation will be analyzed as a case study in mass gathering medicine, as Saudi Arabia each year refines hospital protocols to safeguard the well-being of pilgrims from over 100 countries. Smaller-scale hospital improvements were reported elsewhere. In United Arab Emirates, UAE, the focus has been on specialized service enhancement. For example, Dubai announced that its main government hospitals have now all attained JCI International Accreditation renewal this week, ensuring quality standards in patient safety and care, a point of pride that Dubai Health Authority shared publicly as part of its health tourism promotion. Dubai aims to attract 500,000 medical tourists annually by 2025. The UAE also expanded access at key facilities during the Eid holidays. Abu Dhabi's Seha network extended urgent care clinic hours to 24/7 to handle the surge of holiday-related emergencies. Oman did not open new hospitals this week, but the Ministry of Health signed agreements to upgrade emergency departments in a couple of regional hospitals, with new triage systems to cut waiting times. These are incremental but important improvements for patient experience. Bahrain reported that construction of its long-awaited King Abdullah Medical City Hospital, funded by GCC Development Aid, is now 90% complete and on track for opening by the end of 2025, which will add over 300 beds and tertiary oncology services. While not immediately affecting this week, the Health Ministry's update on that project gave a morale boost in Bahrain, as it promises to significantly expand capacity soon. In conflict-affected countries, hospitals are in a recovery or survival mode. Syria's Ministry of Health announced that Aleppo's Al-Kindi Hospital, heavily damaged in the war, has partially reopened a wing after emergency repairs, now offering 50 beds for internal medicine, a small but symbolic step in restoring healthcare in a devastated region. In Iraq, the government inaugurated a new primary healthcare center in western Mosul on June 7, rebuilding on the site of a clinic destroyed during the ISIS conflict. It will provide maternal and child health services to about 15,000 residents who until now had to travel far for care. Lebanon's hospital situation remained fragile. Hospitals are operating at reduced capacity due to power outages and staff emigrating. The week saw several Beirut private hospitals threaten to suspend dialysis treatments in July if the government doesn't pay overdue subsidies, highlighting a brewing crisis in non-communicable disease care. Yet even amidst hardships, there are instances of hospitals serving as beacons. Jordan's field hospital in Gaza, which has been continuously staffed since 2009, remained operational throughout the recent conflict and this week was noted for treating thousands of injured Palestinians, even as it suffered shortages. One Jordanian nurse injured in Gaza's field hospital was evacuated to Amman for treatment on June 11, underlining the risks medical personnel face and the cross-border support network for them. And in Yemen, despite the turmoil, a health official in Marib announced that the recently expanded Marib General Hospital now has the country's first CT scan machine outside the capital, a modest but impactful improvement for diagnostics, funded by international donors. In summary, this week's hospital developments reflect the region's contrasts. Gulf states are launching ultra-modern wards and orchestrating massive health operations for pilgrimages, whereas conflict-hit nations are struggling to keep basic services afloat or slowly rebuilding. Hospitals remain at the heart of healthcare, and every advance, whether a new transplant unit in Doha or a refurbished clinic in Mosul, directly translates to lives saved and improved. As evidenced by these stories, Middle Eastern countries are investing in hospital infrastructure as a cornerstone of their health systems, while also leveraging hospitals as training and research grounds to raise the overall standard of care. Finally, let's talk about population health management. Population health management, the organized effort to improve health outcomes across communities, was a thread running through many initiatives this week, as countries aim to strengthen prevention, surveillance, and universal health coverage for their people. A notable trend is the drive towards universal or expanded insurance to manage population health costs and access. Bahrain's impending mandatory insurance rollout for expatriates and visitors, detailed in policy and initiatives, is fundamentally a population health reform. By shifting over 2 million non-citizens onto insurance, Bahrain intends to relieve overcrowding at public facilities and free up resources to focus on citizens' healthcare. The scheme also extends insurance to previously uncovered groups, like dependents of expats, ensuring more of the population can seek timely care rather than avoid treatment due to cost. In parallel, Bahrain is directing part of its health budget to build new primary care centers and upgrade hospital departments. These upstream investments in infrastructure and a national health data network, planned as part of the insurance reform, will enable better population health tracking, for instance, identifying hotspots of chronic disease or integrating care for frequent utilizers of services. By this comprehensive strategy, Bahrain expects to improve health outcomes through earlier interventions and prevention, while controlling long-term costs, essentially managing the health of its population more proactively. Kuwait also took steps in population health management by focusing on both communicable and non-communicable threats. The launch of its National AIDS Strategy 2025 to 2029 in May sets a roadmap for controlling HIV at the population level. The strategy includes expanding routine screening, particularly for high-risk groups and pregnant women, improving linkage to care with the goal of 90% of HIV+ individuals on treatment, and public education to reduce stigma. Although HIV prevalence in Kuwait is low, the strategy is a preventive population health measure to keep it that way over the coming years. In terms of NCDs, Kuwait's health authorities continued their aggressive campaigns against diabetes and obesity, common issues affecting well over a third of the adult population. This week, government clinics offered free risk assessments as part of a Know Your Numbers drive, checking thousands of Kuwaitis for blood sugar and blood pressure levels. Such screening programs, coupled with the country's sugar tax on beverages and plans to mandate calorie labels at chain restaurants, illustrate how Kuwait is attempting to manage lifestyle disease trends at the population scale by both policy levers and individual engagement. Disease elimination and surveillance programs were another key facet. In Bahrain, the Gulf Regional Workshop on Measles Elimination hosted in Manama, with participants from all GCC states, is essentially a population health initiative on a multinational level. The workshop, which concluded June 1, resulted in a coordinated plan to boost measles vaccine coverage, aiming for greater than 95% in each country, and synchronized outbreak response protocols among the Gulf countries. By treating the Gulf as one epidemiological unit, given the high travel and expatriate movement, health officials are managing measles risk for a population of over 50 million collectively. This is timely, as measles outbreaks have flared in some Middle Eastern countries recently due to pandemic disruptions. The Gulf's unified approach, including possibly a shared measles-rubella vaccination week in 2025, should strengthen herd immunity and inch the region closer to the WHO's measles elimination goal. Post-conflict population health needs also received attention. The United Nations Relief and Works Agency, UNRWA, and NGOs in Syria and Lebanon are actively managing the health of displaced populations. In Lebanon, as noted, funding cuts threaten refugee health services, but health NGOs are trying to fill gaps by deploying mobile clinics to refugee camps and doing population-level mental health and nutrition assessments. The data presented this week by aid groups, for instance, almost 80% of Syrian refugee households in Lebanon skip healthcare due to cost, is being used to advocate for more international support to manage this vulnerable population's health. Jordan, similarly, through its health ministry and UN partners, is implementing a refugee health information system to track key indicators, vaccination rates, antenatal care, etc., across refugee camps and urban refugees, aiming to not let health standards slip below those of the host population. This is population health management in a humanitarian context, ensuring equitable health access and monitoring health trends among subpopulations like refugees so that interventions, e.g., a cholera vaccination campaign or mental health program, can be triggered early. Several countries continued national screening and registry programs targeting chronic diseases as part of population health. Egypt's famed 100 Million Health campaign, though officially concluded, had lasting structures that are still active. For example, this week Egyptian PHC units were following up with thousands of citizens identified with hypertension and diabetes during the mass screenings over the past 2 years. The health ministry reported that its chronic disease registries now cover over 70% of expected cases nationwide, allowing for better management. Patients are enrolled in SMS reminder systems for medication and checkups, a model of continuous population health engagement. Iran, dealing with malnutrition pockets due to economic hardship, coordinated with WHO to launch community nutrition education in rural provinces this week. Health workers are teaching families about affordable, balanced diets using local foods, which is aimed at reducing the high anemia and stunting rates noted among Iranian children in poorer areas. Over half of children in some provinces are malnourished, as per a recent WNCRI report. By addressing social determinants of health such as nutrition and poverty, Iran is implicitly working on population health management to prevent a slide in health indicators amid tough times. So let's now summarize and conclude this week's summary. In the second week of June 2025, the Middle East's health landscape was defined by a mix of urgent challenges and forward-looking strides, underscoring the region's resilience and evolving priorities. Across countries, one major theme was protection and preparedness, whether from seasonal climate risks, mass gatherings, or outbreaks. Gulf states like Saudi Arabia, the UAE, Oman, and Qatar coordinated robust measures to safeguard workers and pilgrims from the extreme summer heat and infectious diseases, blending policy enforcement, midday work bans, Hajj advisories, with public education to promote wellness. These efforts paid off visibly during the Hajj, where Saudi Arabia's colossal health mobilization successfully mitigated health incidents among nearly 1.7 million pilgrims. At the same time, countries in conflict or post-conflict situations, notably Gaza, Palestine, Yemen, Syria, and Lebanon, remained mired in humanitarian health crises. The collapse of Gaza's health system and Yemen's soaring malnutrition are stark reminders of how war continues to wreak havoc on population health. Regional solidarity and international support are stepping in. Jordan's medical corridor gave hope to Gazan children. The UAE-WHO partnership in Socotra aims to save Yemeni lives, and Gulf states collectively sought solutions for Lebanon's and Syria's disease outbreaks. These contrasts reveal a region of sharp disparities, where on one end advanced hospitals and AI-powered virtual care are reality, and on the other, basic healthcare and nutrition are not guaranteed. Bridging this gap will remain a pressing concern. Another discernible trend is the push for innovation and self-reliance in healthcare. Middle Eastern nations are no longer content to rely solely on imported solutions, they are cultivating domestic capabilities in pharmaceuticals, biotech, and research. This week saw Egypt clinch a landmark pharma joint venture to produce drugs for export, and Saudi Arabia confidently marketing itself as a rising global biotech player with a fully integrated ecosystem. Such initiatives, coupled with investments in local vaccine manufacturing, Iran's COVID vaccine exports, Egypt's vaccine plants, and national health industries, indicate a future where the region is more health secure and even contributes to worldwide medical advances. Similarly, digital health leaps, from Saudi's virtual hospital network to the UAE's e-government health services, are reshaping how care is delivered, making it more accessible and efficient. If these innovations continue to mature, the Middle East could emerge as a model for blending technology with traditional care, improving outcomes while controlling costs. The week also highlighted the region's interconnectedness in health matters. Communicable diseases do not respect borders, as seen with polio, cholera, and CCHF, prompting collective responses like the GCC Measles Elimination Plan and Kuwait's Zoonotic Diseases Summit. Health workforce and financing issues are similarly shared. Gulf countries are aligning policies on expatriate insurance and occupational health, and knowledge exchange is frequent, e.g., Bahrain and Saudi Arabia learning from each other's telemedicine and insurance experiences. This trend of regional cooperation is likely to strengthen, especially via platforms like the EMRO, WHO, and Arab health forums. It suggests that the future of Middle Eastern healthcare lies in collaboration, expertise, best practices, and developing regional health frameworks that serve multiple nations. Looking ahead, major challenges remain on the horizon. Humanitarian crises in Yemen, Syria, and the Palestinian territories will require sustained global engagement to prevent further loss of life and deterioration of health indicators. Non-communicable diseases and mental health burdens are rising in tandem with aging populations and urban lifestyles. The initiatives launched, like Kuwait's and Oman's campaigns, must scale up to avert long-term public health crises such as diabetes epidemics or mental illness waves. Climate change looms as a wild card. This week's heat and ongoing water scarcity point to an era where climate resilience in health, cooling centers, vector control for diseases like dengue, will be critical. On the policy front, the rollout of universal health coverage plans in Bahrain, Qatar, and others will test governments' ability to balance quality, equity, and financial sustainability. Execution will be key. For instance, Bahrain's insurance scheme and Egypt's new drug factories must deliver tangible improvements without unintended disparities. In summary, the week's developments portray a Middle East health sector in dynamic transition. There were impressive gains: a new ward curing child cancers in Doha, an infectious disease halted in Baghdad through decisive action, an Arab-African pharma partnership born in Cairo, all pointing to a more self-sufficient and innovative future. Yet there were also sobering scenes: malnourished children in Gaza and Yemen, hospitals struggling under conflict that recall the fundamental humanitarian mission that still lies at the heart of healthcare. The convergence of these narratives in one region underscores that health progress is uneven but underway. By maintaining focus on prevention, embracing innovation, and reinforcing solidarity both within and between nations, the Middle East is gradually equipping itself to meet its diverse health challenges. The trajectory from this week suggests cautious optimism. Even as crises persist, the seeds of long-term solutions are being planted, heralding improved health and well-being for the region's millions in the years to come. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.